evening everyone, I hope you're doing well. My name is Dr. Mohannad Alif and I'm a general/cosmetic dentist working here in Dubai, UAE. And today I want to talk to you about a very important topic, which is the trending Hollywood smile. Now the first thing we want to talk about is that its actual name is not Hollywood style, it's actually a style of how the teeth are. The actual name is actually either veneers or laminate veneers. What are veneers then? Veneers, it's just a top layer, it's a front layer glued to the front of your teeth, just to change the appearance, change the design of your teeth, and of course to maybe enhance the color of your teeth. We usually do them in cases that if your teeth are chipped, if they're broken, if you have any diseases, of course, the color is too dark, all of those are the indications to them. Now of course we don't really do them for young people. I don't do them for young people. I see that as a waste. We see that a lot as well these days. People are coming, we want to do Hollywood smile. Why do you want to do it? They keep telling me, oh, my friend has done it, my sister has done it, my father has done it, so I want to do it as well. Well, of course, that's not an actual reason to go through with veneers, because we do have to shave a layer off your teeth. No matter how small it is, we do have to shave, even if it is to roughen it. Why do we have to do that? Because when we do cement the veneers, you don't want the veneers to be too bulky, or as we like to call it, horse face, which the teeth are two-way protruded outwards, which is not nice actually, no matter how good the design is. Now, if you have nice teeth, if you have a very nice smile, you don't have to do it just because your friends did it. Especially if you're around 20 years old, 25 years old, you're still too young. You can get an ortho, you can get braces, you can get whitening done, and actually have a very nice teeth for another 10 years. You might want to consider about doing it when you hit around 30 years old, when your teeth start to chip. That's usually when it starts to happen, or when you get older, when your teeth are broken. Because I've seen a lot of problems with young people. They would come and they would tell me, yeah, I've done the veneers around a year ago, but now I'm having a lot of problems, there's a lot of bad smell, and the food gets stuck there, my gum is always bleeding. These are things that might happen depending on your doctor and the laboratory that they've done the veneers with. Of course, the veneers, they should not be that bulky. The only reason that the gums are bleeding and the food is getting stuck there is that they're too bulky, so it's helping the food to get stuck there. Of course, you have to do your research before you do that. You have to go to the right doctor, the doctor who knows how to do those things. But I'm not saying that for all the 20 years old. 20 years old, if you have something wrong with your teeth, a little bit of maintenance and taking care of your teeth can go a very long way. See your doctor. Tell him, any problems with my teeth? Why is my gum swelling? Why is my teeth a bit yellow? They can all be fixed. With a whitening, you can get a nice white smile, a natural one. When it comes to veneers as well, of course, you know, we can design them the way we want. Design the shape, make it a circle, we give you canines, change the color, frosty white, like we see a lot, or the natural white. Of course, I don't like the frosty white. Natural white is way more beautiful than all of those. So, sit down with your doctor, hear him carefully. It's not about if you just want to do it just because of your friends have done it. Think about yourself in the future. How do you want it to be in the future? This is permanent damage. And the lifetime expectancy of veneers and laminate veneers, of course, you might know them as lumineers. Lumineers is a very, very thin layer, and it's also a company name. It's not a procedure. So when we do come to do the veneers, we do shave a little bit. Now that's permanent damage. If you want to change them after 10 years, the damage is there. A lot of doctors, they tell you, alright, yeah, we can polish them. Yes, we can polish them if we do remove the veneers, but the damage that has been done is already there. And when it comes to that, even if you do it, it's just a front layer, it's not a crown. There's a difference as well between some of those. Some doctors I've seen, they drill the whole tooth and they put a crown on it. No, that's a lot of damage for a tooth that's only been there for 15 years. So if you want my advice, think carefully about it. Don't do it just because your friends have done it. It's not about money, it's not about anything, it's about your own health. Think about it carefully. See yourself in 5, 10, 15 years. Of course, when you're going to be around 30, 35, 40 years old, you've already gone through most of your life. So yes, you can get the veneers to enhance your smile, but you will really need them. If you don't need them, don't do them. That's my advice. Thank you all for listening and have a good day. I'm Dr. Mohannad.